Sania and Rodney are bringing their 9-month-old son Elias to meet with Dr. Melinda Jen, a pediatric dermatologist at Children's Hospital of Philadelphia. They're concerned about a persistent rash on Elias's face and body.
We thought it was baby acne, but then it started to progress.
As it progressed, he became more whiny and he was like itching his hands. Like I noticed it was really bad and I said, okay, something's going on here.
Yeah, so actually looking at these areas, it looks like he doesn't have baby acne, but what he has is eczema.
Eczema, also called atopic dermatitis, is a skin rash that's common among children. About 1 in 5 young children has eczema.
And children who have families with eczema, asthma, and seasonal allergies are more likely to develop eczema themselves. So you can see that Elias has a couple different type of spots on him. He has these rough, little bit red areas on his back and his legs, and then he has these thicker, darker areas that are on his hands and around his ankles that mean that they've been around for a little bit longer and he's been scratching them more.
No one knows what causes eczema, but the tendency to have it is often inherited. It's not contagious.
Is eczema painful or is it just itchy?
So eczema is really very itchy, and that's the main sensation that babies feel. Sometimes if they scratch so hard that they break their skin open, then those areas can be painful.
Scratched areas can become infected as well.
So right now you notice that Elias has a lot of eczema on his cheeks, and that's very commonplace for babies to have eczema.
In babies, eczema tends to show up on the cheeks and scalp. It can also appear on the arms, legs, chest, or other parts of the body. In older children, eczema is most likely to appear on the insides of the elbows, the backs of the knees, the wrists, the ankles, and the back of the neck. Over time, scratching can cause the skin to become thickened, darkened, or scarred. Because eczema is visible and can draw attention, it may present a social challenge for children and their families.
So is there a chance that Elias could grow out of his eczema, and will there be any leftover scarring?
So there is a chance that Elias's eczema will improve as he gets older.
In most cases, eczema significantly improves with age. Many children with eczema eventually outgrow the condition. There's no cure or perfect treatment for eczema, but you can take steps to keep the condition under control and make your child comfortable. First, bathe and moisturize.
For babies with eczema, having good bathing practices can be very important.
Bathe your child daily, or as often as your doctor recommends, in lukewarm water using a mild soap or non-soap cleanser. Afterward, gently pat off the excess water. Apply lots of moisturizer to your child's damp skin. Ointments and creams are best. During warmer months, a cream, which is lighter than an ointment, might be more comfortable for your child. Choose skin-friendly fabrics.
One of the things that you want to avoid are rough fabrics. Use very smooth cotton clothing and blankets for him.
Also, wash clothes and bedding with mild, fragrance-free detergent, and don't use fabric softener. Discourage scratching. Keep your child's nails short. If he'll wear them, put him to bed with cotton mittens or socks on his hands so he doesn't scratch in his sleep.
Are there certain things that might trigger his eczema and make it worse?
Yes, certain environmental triggers can make eczema worse, causing what's called a flare-up. Talk with your child's doctor about identifying and avoiding the things that may aggravate your child's eczema, like rapid changes in temperature, a dry environment, allergens in your child's surroundings, skin irritants like some soaps, lotions, fabrics, and foods, airborne irritants like fragrances and cigarette smoke, and stress. Treat flare-ups. If your child has a flare-up, he may need medication to help him feel better. Ask your child's doctor about the options.
What you need are topical steroids. And which topical steroid he needs depends a little bit on how bad his eczema is and what age he is.
Elias will be using a steroid ointment. Finally, some children with eczema may benefit from soaking in a diluted bleach bath.
And usually I recommend that about once to twice a week for children who get a lot of infections.
Ask your child's doctor how much bleach to mix into the bath. Have your child soak for 5 to 10 minutes, then rinse off with plain water.
I'll see you back in a couple months, okay? And hopefully he'll look better.
you.
Thank you.
Take care.
After 2 weeks, Elias's parents notice improvements.
We have noticed, his symptoms have been alleviated. It's not as bad, especially it cleared up on his back a lot. His hands are a little thicker, So it's going to take a little bit more time to clear up that area. But other areas seem to be reacting to the doctor's order pretty well.